Huntington's disease. Huntington's disease is a rare, inherited disease that causes the progressive breakdown, degeneration, of nerve cells in the brain. Huntington's disease has a wide impact on a person's functional abilities and usually results in movement, thinking, cognitive, and psychiatric disorders. Huntington's disease symptoms can develop at any time, but they often first appear when people are in their 30s or 40s. If the condition develops before age 20, it's called juvenile Huntington's disease. When Huntington's develops early, symptoms are somewhat different and the disease may progress faster. Medications are available to help manage the symptoms of Huntington's disease. But treatments can't prevent the physical, mental, and behavioral decline associated with the condition. Symptoms. Huntington's disease usually causes movement, cognitive and psychiatric disorders with a wide spectrum of signs and symptoms. Which symptoms appear first varies greatly from person to person. Some symptoms appear more dominant or have a greater effect on functional ability, but that can change throughout the course of the disease. Movement disorders. The movement disorders associated with Huntington's disease can include both involuntary movement problems and impairments. Involuntary movements, such as involuntary jerking or writhing movements, chorea. Muscle problems, such as rigidity or muscle contracture, dystonia. Slow or unusual eye movements. Impaired gait, posture, and balance. Difficulty with speech or swallowing. Impairments in voluntary movements, rather than involuntary movements, may have a greater impact on a person's ability to work, perform daily activities, communicate, and remain independent. Cognitive disorders. Cognitive impairments often associated with Huntington's disease include difficulty organizing, prioritizing, or focusing on tasks. Lack of flexibility or the tendency to get stuck on a thought, behavior, or action, perseveration. Lack of impulse control that can result in outbursts, acting without thinking, and sexual promiscuity. Lack of awareness of one's own behaviors and abilities. Slowness in processing thoughts or finding the words. Difficulty in learning new information. Psychiatric disorders. The most common psychiatric disorder associated with Huntington's disease is depression. This isn't simply a reaction to receiving a diagnosis of Huntington's disease. Instead, depression appears to occur because of injury to the brain and subsequent changes in brain function. Signs and symptoms may include feelings of irritability, sadness, or apathy. Social withdrawal. Insomnia. Fatigue and loss of energy. Frequent thoughts of death, dying, or suicide. Other common psychiatric disorders include obsessive-compulsive disorder, a condition marked by recurrent, intrusive thoughts and repetitive behaviors. Mania, which can cause elevated mood, overactivity, impulsive behavior, and inflated self-esteem. Bipolar disorder, a condition with alternating episodes of depression and mania. In addition to the above disorders, weight loss is common in people with Huntington's disease, especially as the disease progresses. Symptoms of juvenile Huntington's disease. The start and progression of Huntington's disease in younger people may be slightly different from that in adults. Problems that often present early in the course of the disease include behavioral changes. Difficulty paying attention. Rapid, significant drop in overall school performance. Behavioral problems. Physical changes. Contracted and rigid muscles that affect gait, especially in young children. Tremors or slight involuntary movements. Frequent falls or clumsiness. Seizures. When to see a doctor. See your healthcare provider if you notice changes in your movements, emotional state, or mental ability. The signs and symptoms of Huntington's disease can be caused by a number of different conditions. Therefore, it's important to get a prompt, thorough diagnosis. Diagnosis. A preliminary diagnosis of Huntington's disease is based primarily on your answers to questions, a general physical exam, a review of your family medical history, and neurological and psychiatric examinations. Neurological examination. The neurologist will ask you questions and conduct relatively simple tests of your motor symptoms, such as reflexes, muscle strength, and balance. Sensory symptoms, including sense of touch, vision, and hearing. Psychiatric symptoms, such as mood and mental status. Neuropsychological testing. The neurologist may also perform standardized tests to check your memory, reasoning, mental agility, language skills, spatial reasoning. Psychiatric evaluation. You'll likely be referred to a psychiatrist for an examination to look for a number of factors that could contribute to your diagnosis, including emotional state, patterns of behaviors, quality of judgment, coping skills, signs of disordered thinking, evidence of substance abuse, brain imaging and function tests. Your provider may order brain imaging tests for assessing the structure or function of the brain. The imaging technologies may include MRI or CT scans that show detailed images of the brain. These images may reveal changes in the brain in areas affected by Huntington's disease. These changes may not show up early in the course of the disease. These tests can also be used to rule out other conditions that may be causing symptoms. Genetic counseling and testing. If symptoms strongly suggest Huntington's disease, your provider may recommend a genetic test for the non-typical gene. This test can confirm the diagnosis. It may also be valuable if there's no known family history of Huntington's disease or if no other family member's diagnosis was confirmed with a genetic test. But the test won't provide information that might help determine a treatment plan. Before having such a test, the genetic counselor will explain the benefits and drawbacks of learning test results. The genetic counselor can also answer questions about the inheritance patterns of Huntington's disease. Predictive genetic test. A genetic test can be given if you have a family history of the disease but don't have symptoms. This is called predictive testing. The test can't tell you when the disease will begin or what symptoms will appear first. Some people may have the test because they find not knowing to be more stressful. Others may want to take the test before having children. Risks may include problems with insurability or future employment and the stresses of facing a fatal disease. In principle, federal laws exist that make it illegal to use genetic testing information to discriminate against people with genetic diseases. These tests are only performed after consultation with a genetic counselor. Treatment. No treatments can alter the course of Huntington's disease. But medications can lessen some symptoms of movement and psychiatric disorders. And multiple interventions can help a person adapt to changes in abilities for a certain amount of time. Medications will likely evolve over the course of the disease, depending on overall treatment goals. Also, drugs that treat some symptoms may result in side effects that worsen other symptoms. Treatment goals will be regularly reviewed and updated. Medications for movement disorders. Drugs to treat movement disorders include the following. Drugs to control movement include tetrabenazine, xenazine, and deutetrabenazine, Austedo, which have been specifically approved by the Food and Drug Administration to suppress the involuntary jerking and writhing movements, chorea, associated with Huntington's disease. These drugs don't have any effect on the progression of the disease, however. Possible side effects include drowsiness, restlessness, and the risk of worsening or triggering depression or other psychiatric conditions. Antipsychotic drugs, such as haloperidol and flufenazine, have a side effect of suppressing movements. Therefore, they may be beneficial in treating chorea. However, these drugs may worsen involuntary contractions, dystonia, restlessness, and drowsiness. Other drugs, such as olanzapine, Zyprexa, and aripiprazole, Abilify, may have fewer side effects but still should be used with caution, as they may also worsen symptoms. Other medications that may help suppress chorea include amantadine, Gocovri, Osmolex, levetiracetam, Keppra, Alephsia XR, Spritam, and clonazepam, Klonopin. However, side effects may limit their use. Medications for psychiatric disorders. Medications to treat psychiatric disorders will vary depending on the disorders and symptoms. Possible treatments include the following. Antidepressants include such drugs as citalopram, Celexa, escitalopram, Lexapro, fluoxetine, Prozac, and sertraline, Zoloft. These drugs may also have some effect on treating obsessive-compulsive disorder. Side effects may include nausea, diarrhea, drowsiness, and low blood pressure. Antipsychotic drugs such as quetiapine, Seroquel, and olanzapine, Zyprexa, may suppress violent outbursts, agitation, and other symptoms of mood disorders or psychosis. However, these drugs may cause different movement disorders themselves. Mood-stabilizing drugs that can help prevent the highs and lows associated with bipolar disorder include anticonvulsants, such as Valproex, Depakote, carbamazepine, Tegretol, Carbitrol, Epital, others, and lamotrigine, Lamictal. Psychotherapy. A psychotherapist, a psychiatrist, psychologist, or clinical social worker can provide talk therapy to help with behavioral problems, develop coping strategies, manage expectations during progression of the disease, and help family members communicate with each other. Speech therapy. Huntington's disease can significantly impair control of muscles of the mouth and throat that are essential for speech, eating, and swallowing. A speech therapist can help improve your ability to speak clearly or teach you to use communication devices, such as a board covered with pictures of everyday items and activities. Speech therapists can also address difficulties with muscles used in eating and swallowing. Physical therapy. A physical therapist can teach you appropriate and safe exercises that enhance strength, flexibility, balance, and coordination. These exercises can help maintain mobility as long as possible and may reduce the risk of falls. Instruction on appropriate posture and the use of supports to improve posture may help lessen the severity of some movement problems. When the use of a walker or wheelchair is required, the physical therapist can provide instruction on appropriate use of the device and posture. Also, exercise regimens can be adapted to suit the new level of mobility. Occupational therapy. An occupational therapist can assist the person with Huntington's disease, family members, and caregivers on the use of assistive devices that improve functional abilities. These strategies may include handrails at home, assistive devices for activities such as bathing and dressing, eating and drinking utensils adapted for people with limited fine motor skills,